Dadgummit, where in the world is Waldos COVID-19 vaccine? I've been getting this question now for weeks. It's starting to get into a bit of a frenzy for a lot of our patients, our family members, our friends. Where do I get the vaccine? Did you get the vaccine? Oh my God, I haven't gotten it. I don't know how to get it. What do I do? Where do I go? I was talking to a bunch of my colleagues, rheumatologists, and I said, are you getting this question? And they all threw up their hands and said, yes, we're all being asked. Not one of us know. And that's the story here. We don't know. Meaning we'd like to know. You'd think we should know. I mean, I'm teaching a lot about the coronavirus and how to treat it and whatnot. I think I should know. I mean, I did get my vaccine through my employer at my hospital. Why don't I know where my patients can get it? Well, it's sort of a consequence to how this has been handled. Let's talk about some facts. Operation Warp Speed, tremendous public-private partnership, resulted in an amazing feat of vaccine development in record time and putting this vaccine on the market starting in late December. And now it's available. Where is it? But Operation Warp Speed also had the stated goal of greater than 80% of the 330 million Americans being vaccinated by late June. At this rate, I don't know if we're going to get there. We'll talk about the numbers in a second. Really what we need, 330 million Americans, that's about 250 million adults over the age of 18. We need to get 200 million vaccinated, at least to get to some version of herd immunity, or again, some number north of that would be great. But we still have a tremendous deficit going on here. One of the weaknesses here was the federal government's plan to make the drug, ship the drug, and then leave it up to the states. I'm sorry, the states just don't know what to do. Many states are really good. The health departments have been planning and are well able to handle the problem. Many of them have not been able to get the vaccine that they've requested to put it into arms. Many of them don't really have a good plan. If you think the health department in Oklahoma, Arkansas, Maine, New York, Colorado, and Montana are the same in how they're handling this, you're sorely mistaken. Everybody is right now doing this by the seat of their pants, being led by a few. Maybe a new administration with a more central effort for distribution and administration, maybe that'll help the problem. Again, it's not been very fair. A lot of young, healthy doctors have been vaccinated, even though they're not frontline healthcare workers. I see a lot of patients. I'm not a frontline healthcare worker, but I do see patients, but I'm not in the trenches of COVID. I got vaccinated on the second day it was available in Dallas. I've received my second vaccine, and yet I'm still practicing safe health practices with my mask, my goggles, my hand washing, and my distancing. So, we're telling our patients, get on a list. And that's going to be one of my recommendations here. Get on the list, either with your healthcare system, your job, your pharmacy, your hospital. It's hard to say what works in your area. When us doctors sit around and talk to each other, we don't know where to get it. We tell everybody, listen to the news. The news reporter seems to have the latest scoop on which pharmacy just got a shipment and where it's available. That doesn't quite seem right to me. Probably doesn't seem right to you. The pharmacies are very involved, but at this point, Walgreens, CVS, the rest of them, they haven't got a clue. They are in the early stages of negotiation. They have plans to give it to you when it's given to them, but they're not getting it right now. Pharmacies are getting it in a very sporadic and a healthcare need sort of way. So underserved areas are likely to go to a pharmacy rather than to a healthcare system. But generally, the big pharmacies are not getting this. They will at some point, and they will do a bulk of the work. But right now, while they've been in the discussions and had their CEOs touting, we're going to be involved and we're going to be vaccinating the nursing home people and whatever. So far, CVS, Walgreens, the rest of them, useless to the rest of us. They need to get the supplies they need to help you get this drug, this vaccine. So here are some of the achievements of where we are so far. Worldwide, 71 million doses. Remember, you need 2 doses. That's like, cut that number in half. But that's worldwide. In the United States, it's about 24.5 million doses have been given. 6% of the U.S. population has received 1 shot. 1% of the U.S. population, 1% has received both vaccine shots. Yikes. It's estimated that as much as 50%, 47% of distributed drug has not yet been administered. Now, is that because of holdback for the second shot? Partly, but there's still a lot of drug that's going unused. In the VA, the Veterans Administration, they have actually used 56% of their allotted vaccinations, which means 44% has not yet been allocated. Interestingly, the very first phase of vaccination was supposed to go to 21 million healthcare workers and 3 million domiciled nursing home elderly patients. Interestingly, 2.7 million elderly people in nursing homes have received the vaccine so far. That's one number I've seen. If that's true, that's fabulous. I know for a fact that less than half of the healthcare workers have been vaccinated, and that's hampered by the fact that somewhere between 20 and 40% of healthcare workers refuse to get the vaccine. That's a special kind of stupid. But nonetheless, healthcare workers are supposed to be right at the front line. What about the rest of you? Teachers, people who are elderly, people who have medical problems. Again, I'm telling most of my patients, you're not immunosuppressed, you're not on immunosuppressives. But when it comes time to get the vaccine, jump up and down and say, I'm immunosuppressed, I'm taking immunosuppressants, hoping that you can get the drug sooner. But here's, I think, the big takeaway. The big takeaway is there's a tremendous amount of confusion. There's a tremendous amount of chaos. It's being driven by the media. They've turned the craziness about the weather report now into the craziness about the COVID vaccine. Don't buy into it. You're all going to get vaccinated in due time. Everyone's going to get theirs by March. Some of you by February. If you're older, if you've got multiple medical problems, you'll be getting on lists. For right now, try to get on the list that you can. It's sort of like going to the grocery line with your family. Bobby, you get on that one. Sarah, you get on that one. My husband's going to be on this one. Whichever one's moving faster, we're going to get on. That's what you got to do. And whoever serves you first, congratulations, you win. At this point, you can, calm down, wait, have a mocha latte or cup of tea, read anything but COVID news, turn off the television, read a good book, enjoy yourself. Police Academy, they got 1, 2, 3, 4 episodes of Police Academy. Right there, that's 12 hours that you could kill. So you can wait and calm down, or you can fight and get stressed out and go berserk and say, why not me, why not me, why not me? Again, being hell-bent is not going to make you safer, happier, smarter. If you are hell-bent and determined, my advice is get on lists. If you know there's a place that's giving a vaccine, especially a hospital healthcare system, you might cruise by there at the end of the day or try to make friends and hope that you can be one of these people who are inadvertently getting vaccinated even though it's not your turn yet. That's happened in a few instances. The state rules vary widely. Some are saying that, the next in line are the 75-year-old, some at 65 years old, sometimes at 60 with medical problems. Again, the rules are just crazy nationwide. Be calm, get on a list, be opportunistic if you can, but again, you'll be safe if you continue the safe practices of avoiding congregate settings, bars, stadiums, even outdoor picnics, 6-foot distancing, wear your mask. It really does work. Wash your hands. You're going to be just fine. And you will get your vaccine. Waldo will get his wherever he is. That's my rant for today. I'm Jack Cush, executive editor of RoomNow.com. Go to RoomNow.live to register for our next great meeting.